Hi there, my name is Dr. Darko from Kemet Hospital, and this morning I would like to talk about hernia. So, in my brief utterance, I'll talk about what hernia is, the various types of hernias, causes and risk factors of hernias, some of its complications, and how we can treat or manage. So, what is a hernia? A hernia is basically an outparture from a confinement. So the body is nicely stuck to keep all the organs intact. And you have a herniation or a hernia if there's any weakness in the confinement, thereby allowing the internal organs to protrude. So in a nutshell, that's what a hernia is. So in layman's term, it's like having a crack in a dam. If you have a crack in a dam where there's any weakness, you have the dam eventually collapsing and the water flowing through that crack. So that's what a hernia is. What are some of the types of hernias? So we can have a herniation in any part of the body, from the brain to the chest to the abdomen, just to mention a few. But for the purposes of the discussion, we're going to talk about the abdominal hernias. For the abdominal hernia, they occur from this part of the chest to the groins. So from this part of the body to the groin, can have an outpatching, which we call the hernias. And so if you take the abdomen, we have the ventral hernias, which are, so see, the umbilical hernias, the paraumbilical hernias, the epigastric hernias here. And if you take the groin, which is the one we properly know as the inguinal hernia, you have all those ones happening in the groin. We also have the type that happens in women called femoral hernias, which also occurs in the groins. So by popular belief, people think hernias will occur in men, but that's not the case. We have some hernias occurring in women, particularly the femoral ones. So what are the causes and risk factors of hernias? You have the herniation. To have the hernia, you have satisfied these two conditions. One is a baseline defect, and the other one being an instigating factor. So for the baseline defects, some people are born with certain defects in, say, the stone part of the abdomen or the confines. And if you have this baseline defect and then you further instigate it by, say, carrying heavy load or being in some occupation that causes you to increase your abdominal pressure, such as weightlifting, masonry, carpentry, any occupation at all that, let's say even fishing, any occupation at all that causes you to strain, you can instigate this baseline underlying defect that will cause the hernia to occur. There are other conditions too that can instigate these hernias, such as having a chronic cough. Because if you're coughing, you strain. If you strain, you increase the pressure in your abdomen, and by so doing, if there's any defect in your abdominal wall, abdominal cavity, you can have these hernias occurring. Another one is also those people that have prostate issues. Because if you have prostate issues and you have to strain to you again increase the pressures in your abdomen, and by so doing, you kind of force out your abdominal contents. And if there's any weakness again in your abdominal cavity, you can have a hernia forming. So these are some of the causes and risk factors of hernias. For complications, one of the most dangerous ones, which can be life-threatening, is when you find your intestines or intestinal contents trapped in some of these hernias. And then when that happens, that part of the intestine uses blood supply, and it can indeed be life-threatening and need urgent surgical intervention. So that's one complication of hernias. Another complication of a hernia is what we call obstruction or incarceration, where again you have the intestinal contents trapped inside the hernia. It can't go back. It's just permanently trapped in there. So these are some of the few complications. And of course, the physical burden it gives you. Imagine having a brand pinch hernia in your groin that has descended deep into your scrotum. Of course, it can hamper so many activities of yours, like even sexual intercourse, in your day-to-day activities. So these are some of the complications of hernias. By way of treatment, the treatment depends on the cause and sometimes even the age. If you take kids, for instance, from the ages of 1 year to 2 years, that have these big umbilical hernias, which is the one that protrudes through the umbilicus. Some of them, we give them up to 2 years, sometimes up to 3 years. If most often than not, it resolves on its own. But if after 2 years it hasn't resolved, then we now resort to surgical remedies, whereby we repair the defect, then it goes back to normal. But the other common ones, such as the inguinal hernias, the one that descends into the scrotum or the one that occurs in the groin region, the only treatment, unfortunately, is through surgery, which is very simple. Day surgery, where you come to the surgery and go on the same day. Simple, where you lie down, we just correct the defect and then push everything back in, that is intestinal contents, and then close the defect. You're good to go. So that's some of the treatments for the hernias. For these hernias in really old patients, that in really bad states, we have what we call trusses, which were kind of squeeze the hernia rings, but those are not really done these days. So I would say the main treatment is surgical remedies. Sometimes hear out there that you have herbal concoctions and whatnot that can treat hernias. The best of my knowledge, these are not true. These don't work. Hernia is not malaria or diabetes. It's an anatomical defect, and the herbal drugs really have no part to play in its management. So for me, I would say you shouldn't believe anyone who says you can treat these hernias with herbal concoctions, but they don't work. It's an anatomical deformity that needs surgical correction. Yeah, so that's what I would say. And then there are some myths about hernias and hernia surgical management that I would like to debunk, such as one being, if you have a surgery, it can affect your manhood, it can affect your sexual performance. I can say emphatically that it's not true. Where the penis is and where these hernia form, they are in two different regions. Where we operate is different from where the penis is. The nerve that is responsible, or the artery that are responsible for erection or whatnot, they don't go through your scrotum. They are two different regions altogether. So there's no way or form surgical correction of hernia causes erectile dysfunction or sexual performance. So that's one thing I'd like to put out there. So again, thank you very much. Pleasure to discuss hernia and its management with you. Again, I'm Dr. Darko from Kemet Hospital. You can contact us on 0244 780 532 and 026 022 4647. Or you can check that out on our website at www.kemethospitalgh.com. Thank you again. Brought me through, so the essence of my